Hello everyone. In this video we'll talk about the dipstick, which is the second component of the complete urine analysis. The dipstick provides a rapid semi-quantitative assessment of many urine parameters on a series of test pads. We will talk about them in details. Specific gravity. The specific gravity in urine analysis measures hydration status and the kidney's ability to concentrate urine. The normal range between 1.005 and 1.03. A high specific gravity indicates that the patient could be dehydrated or have hypoperfusion to the kidney, such as in severe dehydration from excessive fluid loss. A low specific gravity indicates dilute urine from excess hydration or impaired urine concentration, as in diabetes insipidus, sickle cell nephropathy, and acute tubular injury. pH. pH of the urine can also be measured. The normal is between 5 and 6.5. High pH more than 7, as in renal tubular acidosis type 1 and vegetarian person, while low pH can occur in renal tubular acidosis type 4. Protein. Trace positive protein can be normal. There is various types of protein, but the dipstick is most sensitive toward albumin. However, the dipstick cannot detect most cases of moderately increased albuminuria from 30 to 300 mg a day, formerly called microalbuminuria, which is important for patients with diabetes, since those patients can benefit from citrate ACE inhibitor or ARBs to protect their kidneys. For that reason, protein creatinine ratio or albumin creatinine ratio or a 24-hour urine collection is required to avoid moderately increased albuminuria go undetected by dipstick. False negative dipstick can occur in dilute urine, and false positive may be the result of concentrated urine. Blood, heme pigments. The way blood is picked up on dipstick is peroxidase activity is detected on your dipstick. You may see blood or heme pigment in your urine. This is always abnormal. If RBC are absent but blood is still positive, this could be myoglobinuria, which could be secondary to muscle breakdown, or hemoglobinuria, which could be secondary to intravascular hemolysis. A false positive can occur when there is peroxidase expressing bacteria or drugs such as chloroquine or rifampin. Glucose. Another thing you should never see in your urine is glucose. This is a clear sign of diabetes. However, there is a low threshold for this during pregnancy. Glucose starts to leak into the urine once the plasma level exceeds 180 mg per deciliter. Proximal tubular dysfunction can be the cause if there is no diabetes mellitus. Ketones. If you see ketones in the urine, this could indicate DKA, starvation, vomiting, or intoxication with isopropyl alcohol or salicylate. Leukocyte esterate and nitrate. Positive leukocyte in the urine indicate a leukocyte more than 5 on high power field. Nitrate in the urine suggests a gram-negative bacteria such as E. coli, Klebsiella, or Proteus. A patient can have UTI and his nitrate is still negative, such as in cases of UTI with a gram-positive bacteria, or if there is inadequate contact with the urine. Both leukocyte esterase and nitrate being positive is highly predictive of a UTI, while both being negative has a very high negative predictive value for the UTI. Bilirubin can be positive in the urine only when it's in the conjugated water-soluble form. This could be seen in patients with severe liver disease or obstructive hepatobiliary disease, and is also always abnormal. Bilirubin metabolized into urobilinogen in the GI system then reabsorbed onto the blood. If this is positive in the urine, it indicates hemolytic anemia or parenchymal liver disease. I hope that we covered the most important point in urine analysis.